All right, Maggie. So let's start by like, can you like introduce yourself a little bit?
For sure. Yep. Yep. Maggie Bryant. I am currently based out of Los Angeles, but originally from Minneapolis, Minnesota, or about an hour north of Minneapolis. Grew up there and completed my collegiate schooling and my doctorate of physical therapy in Minneapolis before going on to complete a sports residency in Southern California. Following that experience, I had a ton of passion for sports, had a ton of passion for basketball specifically. I played in college, and ran track as well. So thought it would be just an awesome opportunity to continue working in some sort of sports environment. So worked back to went back to Minnesota. Worked at a sports medicine clinic, Mayo Clinic, and was really fortunate. Was fortunate to work with a lot of people, a lot of different sports, a lot of different athletes, a lot of different teams, a lot of different clinicians, and just really get a great sense of um, what type of sport, what type of athlete, and all of that. And it was a great experience before essentially going into the pro sports realm. And started at Orlando, and then now I'm currently with the Clippers.
Cool, cool. So you say you run track.
I ran track. Yep.
What like are you like a sprinter or like long distance?
More mid distance. So I mean, I wasn't by any means was I great, but I did the 400, the 800, a little bit of 400 hurdles. So
Okay, okay. Do you still
yeah.
follow like track? Because I know like Olympic trials like today.
Yeah. I don't follow as much as I used to. I like watching it actually. It's really fun, but I don't like follow it per se. Not like basketball. Obviously, I follow that pretty closely.
So, all right. I'll start with this one. Do you think being an athlete help you grow as a practitioner, like physical therapist?
For sure. For sure. Yeah, I think you know, being an athlete, you just have a different appreciation for the body, for the work ethic that's involved with success, working in a collaborative environment, being kind of at your like I've suffered a lot of injuries, so that's ultimately what kind of got me here. And I've seen what really good care can do for you, and I've seen what not great care can do. And I've just seen again the importance of the human body and how that can affect your performance and your longevity and all of it. So I have a different appreciation, I think, for the players that are dealing with an injury and then just having an awareness of all the factors that play into their recovery, the emotional, the psychological, the physical. So I think it helped me. Yeah, for sure. And I
Nice.
still play and I still work out a lot. So I try to do my rule is anything I put a player through, I should be able to do. So I play a couple times a week. I do the lifts that they do. I do whatever cardio workouts I'm going to give. Like I try to put them through it. I always do it. So, just staying kind of in that mindset has really been beneficial for me.
You do the same lift they do? Oh, that's awesome.
We have a morning workout crew, so it's like the morning breakfast club, and we have a whole group. And yeah, we'll do like variations that the players. Obviously, I do different weights and stuff, but yeah, I do the whole workout. Any exercise I'm going to put a player through, I will have done before. I'll be able to exercise or be able to show it, be able to do it. So there's nothing that I will give an athlete that I can't do.
So
I
even
might
now,
not do it well, but I will be able to do it. So.
even still now when you're at a management position, you still do the lift. Oh, that's awesome.
Oh yeah, we have a whole group that again, we have a whole group, 10 of us, 5 to 10 of us do it every morning. Blare the music, get the whole staff in there. We hoop, we play 2-on-2 and we played 2-on-2 yesterday, did a whole lift. Yeah, we have a good crew. So I still do it every day. Yep. And I think it
Cool.
again, I think it's important to have an awareness of that. But I think it's important for the players to see it. Like a lot of times players will come and they'll see us playing and they'll cheer and make fun of us. And so it's good on both sides for sure.
Cool. That's cool. I never did that. I'll do that next time.
Yeah, yeah, it's good.
So, the next thing I want to ask is like, in NBA, especially like obviously the players are men's, and most of this like I think most of the staff are men. So what is it like for a woman to be at NBA?
That's a good question. I think there can be challenges at times, but I think, it's all about how you handle yourself and the presence that you provide and the upfront, just how you handle your business, and the kind of the tone you set. And if you set it in the right way and you handle your business in the right way, it's fun and I think you can provide a different lens and you can provide some extra value and it's challenging. It's challenging. You have obvious challenges. Being around a bunch of people in a different gender that again, there are differences, there are challenges, but I just accept it, and they all call me bro, so they all think I'm a guy anyway. But I just accept it and own it, and again, I try to set the tone on day one, and I think if anything, it can help me in certain regards, and the challenges that I have, I just learn from them and grow, and put myself in the best position possible, and I use being a female as kind of motivation too. Like it matters a lot to me that female represent themselves in a certain way. And I take that to heart and I try to do that every day. So
Cool, cool. Can you like share some like challenges you mentioned and how do you deal with that situation?
yeah, I mean it's as simple as, the obvious. The bathrooms are different. A lot of times there aren't female bathrooms close or, anywhere near where I need to be. And I'm treating an athlete and I have another athlete waiting and I have to go find a bathroom and challenges in regards to fine again, professionalism, fine line of the relationships. Being a female, sometimes they don't think that you like they're not able or they're not comfortable to communicate certain things. Again, hopefully you put yourself in a light and in a position to not really be seen as a separate kind of entity. Like we're all together and but you'll be challenged differently, I think, as a female. Like they're gonna test you at times and see if you know what you're talking about. And if you show that confidence, again, I don't think it's a huge issue, but they'll try to challenge you. So
Nice. So I know probably since you start like when you start at the NBA, they probably already use like GPS, force plate, all kinds of data. So uh when you're at the clinic, do you also use like force plate?
when I was in the clinic like 10 years, like a while ago,
Yeah, yeah.
we used force plate, we used some strength metrics, like we did some strength profiling. Yeah, we did all that. Obviously, I do a lot more of it now. And I'm a lot more comfortable with it now. But I would say like back then it was obviously relevant, but it wasn't as commonplace as it is now. So I didn't have a huge comfort level with it, or I knew how to do it, but did I know exactly what each metric meant and how to actually program or modify your protocol based on it? Not necessarily, not to the way I do now. But we utilized them for sure.
So how do you like now how do you implement like these technology with like the rehab process?
Yeah, we implement it early and often. So, pretty much day one. We try to get, a with rehab, you always try to look at what's their end goal? Like what do they need to get back to? And if you have that objective kind of criteria from an on-court perspective or load perspective, from a strength perspective, the strength quality, so jumps and power and all of that. You know what they need to get back to. Pretty easy actually to just work backwards and build in some technology to kind of just make sure you're on the right track. It's kind of like a feedback loop. It's if you're going the right direction, you'll know based on the data, in addition to everything you're seeing in the rehab, and it can help confirm you're on the right track, or it can show you might need to pivot. And so I think again, we use it early and often. We use it pretty much to between kind of quote unquote phases as we progress players to make sure they're on the right track, to make sure they have kind of the foundational key things we're looking at. We track we use it to track tolerance to specific activities. So yeah, we use it every day. So
So you do think that like with these like technology, does that change your approach to rehab or like change the process of rehab?
um yeah, I think so. I think it takes away a lot of the subjective, and ultimately that's the goal. Obviously subjective and the soft skills are a huge part of the rehab as well, but being able to pair the two together is important. So specifically, like for me, working in a population with elite athletes, you're going to get really variable subjective responses based on who that person is and kind of their DNA. So you're going to have certain guys that are pretty very well in tune with their body, and they're going to report everything they feel, and it might skew your decision making a little bit. You're also gonna have guys that are extremely unaware of what they feel, and you might be a little more aggressive on that athlete with when you maybe shouldn't be. So pairing what you feel and what the athlete feels to what you're seeing to some objective data can just kind of guide you along. And so I think it informs you a little bit more throughout the process, and I think it's important. It's like an example is in the early stage of an injury, to track if a player is improving. Obviously, you have kind of the soreness rules or whatever it may be, but like soreness, swelling, stiffness, those are kind of some early tolerance guidelines. If you compare some objective data with some of that early, like you have a rotator cuff and how much force they're able to produce early on into a that's a like a rotator cuff, not repair, but injury. And you're seeing objectively how much stress they can put into that dynamometer, and you're getting an objective number. And even if it's super low number, you're still getting something that now you're able to track. And so you can show the athlete, okay, you're actually improving, or you kind of went down today. Let's look at our plan and let's modify. So I think it just again, it allows you to be uh reactive pretty quick, and it can give some good information.
Cool,
But you also need to know when and how to use it and not over rely on it too. So
cool. So, I want to talk about like movement assessment. So, like, personally, do you use like movement assessment like SFMA, FMS, or like FRC, those kind of stuff, or you kind of build up your own movement assessment?
we've built up our own. We've built up our own just based on, I mean, some of those, like we'll use kind of principles from those, or I think we looked at what's required in basketball, like what specific movements, what both locally and globally. So from a local perspective, like what is that foot and ankle, what does that foot and ankle need for basketball? What is the hip rotation? Kind of what metrics are we looking at? How can we see their movement throughout those metrics locally and globally? And then building on that, what are the big movements they need in basketball? So we know basketball is jumps. We know it's sometimes double leg. We know sometimes it's single leg. We know sometimes they grab a rebound and they have to jump right back up. And it's so, a drop jump where you're seeing some of that, reactive strength. We know deceleration and accelerations are common. Change of direction. So those are kind of our staple movements we'll do, pretty much the ones I just said. So counter movement, single leg counter movement, drop jump occasionally, um, acceleration, deceleration, change of direction. And then, based on those, you can even break them down a little bit to, again, just see even how they're moving in space. And you can kind of glean a lot of information off that. So that's what we try to do.
When doing those movement, do you kind of like utilize like they have like 3D motion captures right now? Do you guys utilize that?
We do. Yep. Yep. So we do at certain time frames. So preseason example is one we'll commonly do the 3D. We're actually building a whole new biomechanics lab in our new facility. So we'll do it more frequently, but we oftentimes just use a phone too. And all right, let me see you do, their foot and ankle structure, something's wrong. Let's see you do a posterior lunge. Let's see how you get into that big toe in the back. Let's see how you move through that hip. Let's do a, step down and let's just see how single leg control you have. All these various tasks. And we'll just do it with a camera or even just our eye at times too. So it's not always 3D, but we do for the kind of big screens, we do try to get a little bit of that too.
So does those always matches with like what you break down to the table?
Yeah, so we do a pretty robust assessment at the beginning of the year. Range of motion, strength. So, we look at the key range of motion kind of things that we value. And then we look at the normative data. We look at their anatomy to see if there's any variation there. And then we pair that with some of the strength profiling that we do, kind of whole lower body, as well as some of the power and jumps, and then some of the movement screen. And then based on all of that, we compile kind of an individualized profile based on that athlete. So whatever it may be, and then just try to, put a cadence in of kind of test retest to just make sure again we're either creating a change or we're not. And if not, then how do we kind of evaluate our process a little bit? So it's been a helpful process.
Nice, nice. So, with all those technology, with uh those like assessment, I know load management is like big topic right now. So, like personally, how do you like think that, or how do you think that like NBA players, they need to handle like 82 games per season, and if you go to playoff, they need to play more. So how do you keep your athlete like healthy during the season and make them stronger?
Yeah, it's a loaded question. It's very individualized to each player. And people always say load management. Load management doesn't necessarily mean reduce load. Sometimes it means you add load. Sometimes it means you maintain load. Like you're just managing it. And so it's individual to that player. And I think, you do have this 82 game season, and sometimes you're playing 5 games in 7 days. And if they're a heavy minute player, they're putting out some significant load numbers. And we've got nowadays we have a lot of tracking device. We have a lot of a pretty large staff to be able to really monitor really closely these athletes. And so I think the first and foremost biggest thing is the off-season training, how they come in. So it's really hard to build on something if they don't have a baseline. So for example, a guy didn't work on their quad strength all year and they've got some knee stuff. They're all off season and they've got some knee pathology. They come into training camp and all of a sudden their knees irritated. Now you're not really able to load them that much because their knees irritated, and you're trying to like prioritize some of the on court stuff too and manage that. So it's hard to build strength. It's hard to build, I put it the amount of load under them that they need to. And so obviously you can still do it, and you definitely should. It just is a challenge. And so if they come in with a really strong foundation, you're not working backwards. You're just building on that, or you're maintaining on that. And that's really key. And so that is a huge push for our organization and our department of, all right, how do we track guys over the summer and the off season? Because we know they need to get away, but we also know they need to work on various things. And hopefully we are very direct with what those things are. And we go out of our way to send people to travel with players or to assess them randomly throughout the off season, at variations. And then so we're at least kind of getting a baseline. And then from that, throughout the season too, we monitor their strength. We monitor their ability to produce force, rapidly with jumps. And if we need to pivot and we need to maybe modify some of the load or take some of the load off to focus on restoring some of that, we will. Obviously, the game is the priority, but you can also see smoke before the fire. And if we're starting to see some trends, we'll adjust. But it's key that they come in with a good foundation. I think it's probably the most important thing.
Cool. And like if they don't have it, you try to build it, build the foundation.
You try to build it. That's when unfortunately the load management has to be key. Is You probably can't build a ton of strength as they're playing 82 games if they're playing heavy. Like in a young development guy, they can play, they can do full lifts every other day, every day, 4 lifts a week, and they can build some really good strength. The guys that are playing heavy minutes and don't have great strength coming into it, it's a challenge for sure. And have pathology that maybe limits them to be able to do it. You got to find some strategies to whatever strategies you can find, and there's a lot, but you gotta work through those strategies because losing strength throughout a season is detrimental, and it's key to try to monitor but also manage.
So, like since we talked about like playing games, load management, so I know like college they play like 30 something games. Am I right?
Yeah.
And like they if they go into NBA, they need to play like 82 games. So how do you prepare like college player to like play like NBA?
Okay, so the positive is the minute they're drafted or the minute they are signed, we get them in and we start building a really robust plan. And we've got it mapped out for every player. Today we had a draft workout, for example, and you get baseline testing on again their strength, their um, ability to jump, their on court data. So you have a baseline, and in addition we'll also baseline test them, and you know exactly where they need to go. And for some guys, it's going to be, all right, you got to lift. You're globally weak, or you're globally weak in this area. We have to do this amount of lifts, and these are additional correctives or exercises we're going to add on. And the on court development is important, but this is also a very, very key piece to it. And then you just monitor closely, because it is a huge jump. And it's usually where they've only played 1 year in college, and it's, yeah, 30 games. And now they're playing 82, and the travel schedule is different. The density of games are different. The intensity is different. The guys are bigger, stronger, faster. It's an adjustment. So it's difficult, but hopefully you get them under your wing pretty quick here.
Cool, cool. So, uh, I want to jump to the next topic. The next thing I want to ask is like you're in a like management position, and I know you start by like being a th physical therapist at the NBA at Orlando Magic, and now you're a management position. So how do you manage a team of like talented practitioners, like strength coaches, physical therapists, all these like athletic trainers, and like build a good communication?
Great question. Communication in pro sports is challenging. There's a lot of moving pieces at all times, and it's to have really robust real-time communication is just it's a challenge for sure. But I think when you're in a management or leadership position, the most important thing are the people. And it's, are you surrounded by the people? Are we rowing the boat in the same direction? And it's huge. We got to be extremely aligned. There's got to be a ton of clarity on what it looks like, what the roles are, what the responsibilities are. And everybody has to have an appreciation for what everybody brings. We have got, like, for example, we've got 4 performance staff, strength coaches. We've got a dietitian. We have 3 sports scientists. We have 2 physical therapists. We have 3 athletic trainers. We have a massage therapist. We have a soft tissue specialist. Every single person that I just listed has a very different lens that they see the athlete through. And every person has something to bring. And so I think when you're, again, in that leadership position, your job is not, as a leader, it's not to be the one with all the answers all the time. It is to be, how can I empower him? He is better at this than I am. How can I empower him in this situation? Or how can I get the best from him? And so, again, I think so often you look at leadership and you're like, all right, I can't say no. I can't say I don't know. They're looking for me because I'm the leader. They are. And of course you have to balance saying I don't know. You can't always say I don't know. But there's just you have a group of people that are super talented. So figure out how to utilize them, figure out how to empower them so everyone feels valued, so everybody knows their role and responsibility. Create extremely clear communication channels where it's, this is how communication is disseminated. This is who can communicate it. This is how the lines go. This is what good communication is. This is what bad communication is. And just the more clarity, I think, the better. And ultimately, again, if you're all rowing in the same direction and you got a group of great people, you'll be super successful. And that's the fun part about leadership is how can I get the best of this group? And to me, that's why I do it. Like it's fun. It's fun to do that.
So, is it a like is it like a hard process to like build those like communication channel, or you had those like idea at the first place?
Um, it's hard when, I use this analogy sometimes. So in the NBA, you're going from, so think about a clinic. A clinic, you have 12 patients, whatever, 12 patients. You have a list in the beginning of the day. You know exactly what each patient's kind of dealing with. You can still definitely have some surprises. And it's a busy schedule by no means, it's busy, but you've got pretty good clarity on what your day looks like. You know somebody's going to come in, they're going to be in for an hour or 40 minutes, whatever it may be. You know the injury, you kind of know your plan. Okay. NBA, you're working weird hours. Sometimes you land at 3 a.m. and all of a sudden a player has an emergency at 3 a.m. So you go from you're passed out on the plane, you're sleeping, or you're working on the plane, you're kind of like going to bed almost, and then boom, something happens. So you're going from 0 to 100. Very hard to communicate like that. It's very hard to communicate when there's real time issues, real time injuries. Staff is like there's fluctuation of staff. Some people sometimes stay home to work with an athlete. Sometimes people are off site, and it's just how do you communicate effectively and efficiently? But also don't rush. That's hard. It's a hard balance because if you rush and you get it wrong in this business, that's not good. These players are $50 million players, and if you miscommunicate something and it gets to the agent and it gets to the media, that's not good. But if you don't communicate something, that's not good either. So I try to over communicate, but also be very, very clear when if there's not clarity on an injury, for example, a player goes down in a game and you got to figure out who to communicate with, what to communicate, how to communicate, when to communicate. So sometimes you can get it wrong, like the initial diagnosis. You think the guy has a calf strain, and the next day the tightness is completely gone, their strength is normalized, MRI is completely fine. Say you diagnose them that night, the next morning it might look totally different. So it's okay to say, look, they're presenting with X. We're going to give this 24 hours to see how it plays out. But I'm letting you know this is our plan. So it's not you're on the other end wondering what I'm thinking or wondering what's going on. I just told you we don't exactly like we are going to see how this plays out. Here's our plan. I will communicate you at this time frame. These are the people I'm going to communicate to. So it's that type of communication that beats the odds of the messiness and the real time and the lack of clarity and the pressure, so it's having kind of that mindset, I think, is really important.
Another part about like the management or like leadership question is like um everybody in the NBA is probably top in our field. So how are you able to like you mentioned, empower them, and like maybe like you said, sometimes you don't know the answer, and just like you mentioned, empower them. Is it like yeah.
So how do you empower people that you work with, you're saying?
Yeah, and like since like you also are talented, you also are top in our field.
Yeah, appreciating what you do know, being confident in what you do know, knowing when it's okay to have the answer, but also being having the humility to know when you don't. And again, hopefully there's a fine line of more often than not, you're in that reason because you do have an answer. And you have collaborated and again, delegated or empowered the people around you that you've collectively come up with an answer. Sometimes you'll have it by yourself. Sometimes, it's a group thing. And then again, other times it's okay to say you don't know. You're not expected to know. You're expected to, when you don't know, empower somebody. So for me, it's again, leadership is all right, how can I get the best out of everybody? What is your greatest strength? What is your greatest weakness? All right. Your weakness might not be communication, but your weakness is you get amazing buy-in with players. I'm probably not going to put you in a high level meeting right away to be the main communicator, but I will put you in front of the player and I will make sure that player gets buy-in because that's your strength versus somebody else. So it's just being able to read the person, knowing what they're passionate about, knowing what they care about, and then again, seeing what their strength is and putting them in positions that they'll succeed. And that to me is again the fun part of leadership. It's not people always say managing people is the worst part, of leadership. Um, and it's just yeah, it's so important to manage people like effectively, but and just have the passion behind it. They're people. Everybody wants the same thing. Everybody wants to feel valued. Everybody wants a voice. Everybody wants to contribute. Find a way to do that.
Nice, nice. Okay, last part of this podcast. I know, like you mentioned, you're a leadership or management position in the NBA, like right now. So, when it comes to like hire like new strength coaches, new physical therapists, new maybe athletic trainers, what are like some types of like characteristic or like some things you're looking to when you hire when like yeah, when you like interview someone?
I think number one, humility. They're willing to say they don't know. They're willing to say they don't have all the answers. Because again, that's huge in sports. You got to play well in the sandbox. How good of a teammate are you? A big phrase is what is it? You decide. I can't now I'm gonna butcher it. Never mind. But it's essentially you disagree. Oh, you disagree, but you commit. So you disagree in the room to go together, but when you walk out that door, you're committed to whatever answer. And it takes a special teammate to do that. Like if I disagree with something that you tell me, but you're the leader, I'm gonna walk out of that room and I'm gonna pretend like I agree with you because that's what our collective alignment is. And so finding people that are again humble enough to be able to have that mindset, competent, a good person at heart. Like we work way too much together. A lot. And we see each other all day, every day, 7 days a week. In the season, you're waking up at 3 a.m. on a plane next to each other and you gotta lug bags in and you gotta find the right people. Cause it's like if you're in a bad environment, just the day to day it's long and it's hard and it's painful. So for me, it's find a really good person, find someone who's humble, who's willing to be a good teammate. The competency is obviously has to be there. Um, yeah, I think that matters more than any specific skill set or like, oh, I do dry needling or whatever. Like you can teach some of those skills. You can't teach someone to be a great teammate and a great person and so that matters a lot, I think.
Cool, cool. And like a lot of like young coaches, physical therapy, they want to go to the league. Like, do you have any like advice for those like young practitioners?
I think first and foremost, like build a really strong foundation. So often I hear, I get some calls from people first year in PT school or even in college, and they're like, I want to work in pro basketball. And I'm like, okay, well, how do you know that? Number one. Number two, first, before you decide that, like learn the orthopedic stuff, get a strong base, learn the neurologic, learn the whole piece of it. And whatever realm of specialty you're in, strength conditioning, sports science, PT, athletic training, don't skip steps to get there. Do it, put the effort in, put the work in, and eventually you'll put yourself in a position to get there if you do all the right things and you make a difference with everyone you talk to and you like to me it's you talk to the janitor, you talk to the patient, you talk to the athlete, you talk to the parents, it's just who you are as a person that gets known. Like that's what I ask about when I do intel on people we're looking at is how do they treat you, how do they treat the chef, how do they treat someone when they're mad about something. Like so as a student or as a somebody applying, a young grad, be very cognizant of if someone called your coworker, what would they say about you? Are you a good teammate? Are you skilled? Are you a lifelong learner? So again, I just feel like so often they try to network to like ask the question, how do I get there? Just to kind of get that connection. And it's a fair question, but just put yourself in the best position by continuing to learn, continuing to grow, find good mentorship, and just treat people the right way.
Last thing, last thing. So, uh, before going to the NBA, you said you work with like different sports, different athletes. So, can you share a little bit like how like those experiences can help you with basketball?
Yeah, absolutely. When you work with an eclectic group of athletes, like I worked with all different types of sports. I saw rowers, I saw football players, baseball, track and field, hockey, all of it. You have to really get an appreciation for the differences in certain bodies, the differences in the demands of the sport, all of it. And you can really learn how to individualize that care for that athlete, and for me, it helps drive it over to basketball where sometimes you'll see the research and it'll say athletes should expect this number strength, 2 times body weight for blank strength in rugby. And sometimes people just translate that to their sport and they're like, oh, well, you should have 2 times body weight. But understand the demands are so different. Like a rower should have very different demands than a basketball player, who should have very different demands than a hockey player. So working with all three, I really got into, or like working with all of them, I got an appreciation for just how to really individualize that care based on the demands that athlete has to get back to. And it's helped me for basketball because, again, it's just I've been able to appraise research differently. I've been able to have some different ideas working with these athletes. And, I think it just helps you have a broader scope of, big picture things.
Cool, cool. So basically that's all for today. So for those who are interested in what we're talking about today, where can they reach out to you?
My Twitter, I don't even know my Twitter account, my Instagram, any of that. Feel free to reach out. Let me pull up my Instagram and Twitter names. My Instagram is magsb55, and my Twitter, I don't know if this is the right answer, but my Twitter is Bryant5Maggie, all one word.
Nice, nice.
Might be the best way. Yeah.